Welcome back to the OHSU Effect Inside Health and Science at OHSU. I'm Lacey Evans. It's no secret that obesity is on the rise in America. According to the CDC, 1 out of every 3 adults is obese, 1 out of 4 in Oregon. And, this isn't just about being fat, it's about overall health. With us now on the OHSU Effect to talk about obesity in adults is Dr. Jonathan Purnell, who is in the Division of Endocrinology, Diabetes, and Clinical Nutrition at OHSU. Hi, doctor.
Hi.
Obesity is not as simple as people think. It's more than just eating too many calories. So what are the different factors that affect weight gain and retention?
Well, it's as simple as eating too many calories in some ways, but it's more complex than that as well. What getting people to gain weight has to do with an imbalance in their energy intake and their expenditure. But it turns out that what gets you there is actually a very highly regulated process. So in other words, there's a command central for body weight in your brain, and it determines if you're weighing just the right amount or too little or too much. So if you're predestined to gain weight, typically from a genetic predisposition, and you're in the right environmental circumstances, your brain will bring your body weight up. And despite your efforts at trying to improve lifestyle, exercise, and diet, you can still put on weight and become obese.
So what are the key factors here? Is it what we're eating, portion control, processed foods? What are we talking about?
Well, it's a combination of genetics and environment. There is a very strong genetic predisposition, but what really has changed over the last 20 to 30 years is our environment. And that includes the types of foods we eat as well as the amount of activity we get. And this gets very complex very quickly. But in the context of the types of foods we eat, we're still not eating as healthy as we should. And in fact, as a society, the total amount of fat in our diet has remained stable for the last 20 to 30 years, and we're eating more processed foods. In terms of the environment, it's not just having a gym on every corner and making sure everyone works out for an hour a day. It probably has a lot to do with how much activity we get in the workplace, as well as how much we get just walking around or doing our daily duties.
What kind of research at OHSU are you doing to combat obesity?
Well, really fundamentally, there's my area of research is trying to understand the basic physiology behind unwanted weight gain and expression of obesity, and more importantly, why it is so difficult to lose weight afterwards. We also have other people doing research into childhood obesity, particularly changing the school environments to make it more conducive to become more active, as well as what we call maternal nutrition and the impact of a mom's diet on the predisposition for the baby for adult chronic diseases.
Interesting. Well, you're mentioning babies, and I wanted to talk about obese kids, and you're saying that a lot of this is genetically disposition. So are we kind of programming our kids to be overweight?
Well, there's 2 ideas about that. One is that we're probably exposing children, particularly those who are most genetically vulnerable, to probably the worst environment you could have if you wanted to put on weight. But in addition to that, there's a movement here at OHSU and around the world trying to understand how the environment of the babies in utero, in the uterus, might predispose them to further weight gain beyond just what they get in the environment.
What kind of treatment options are available for overweight and obese people?
So once you've become overweight or obese, we treat that condition like other chronic diseases of adulthood, like diabetes and like hypertension. And we emphasize first and foremost improvement in lifestyle. So healthier eating, lower fat total intake, higher fiber intake, more regular fruits and vegetables type stuff, and more activity. As I mentioned before, that's not just going to the gym and working out. It's actually trying to incorporate it into your lifestyle. Portland's great for that because you can take the bus and walk to places, and the public transportation systems allow that. But a lot of people don't realize very much weight loss, if any, by instituting those measures. Some people will lose quite a bit, but the average weight loss to a healthy lifestyle is about 5 to 10 pounds, and most people don't realize that, even if you're working out on a regular basis. So once people have done that, then they have options in terms of medical management. There are medicines that are currently available to treat weight loss or to treat weight loss and prevent weight loss regain, but also surgical management as well.
Yeah, I was going to ask you about that. Do you like the surgical options? Do you recommend that to patients?
The honest truth is that bariatric surgery, is our best option now for meaningful, sustained weight loss. And it's only been the last 5 to 10 years we've come to understand the physiology behind it. It's not just simply making the tube smaller or creating a malabsorptive state. There's actually changes in the underlying physiology that occur that allow people to not feel as full when they eat, to not eat as much, and to maintain that weight loss on average for now 15 to 20 years. So, again, we look at obesity like a chronic disease. If you had cancer, you would certainly choose any of the number of options, lifestyle, medicines, and surgery. And really, that's the way we look at obesity. And surgery is our best option today.
So you talked a lot about environment and lifestyle changes. What other hurdles are there that get in the way of people who want to lose weight?
Well, again, I call it life interferes with your best of intentions. They can be work-related. They can be personal-related. You have people who really try to do as much as they can in terms of activity, but if they're holding on 2 jobs or they're taking care of an older relative or something like that, it really does limit what they ultimately can do.
What kind of obesity services are offered at OHSU?
Well, we have the gamut of nutritional services. There's 2 of us up there who run clinics offering medical therapy beyond lifestyle measures. And then we have a surgery program as well. And we're forming now what I call a multidisciplinary or interdisciplinary obesity clinic, where the medicine docs and the surgery docs are working together. A lot of times, referring physicians or patients don't really know their options and aren't sure exactly what's best for them. And so this offers a gateway so that people can receive consultation and have the opportunity to potentially participate in either or both.
Well, really quickly, how can people get in touch with you or set up an appointment?
Call the clinic, and I don't have the number with me actually right now.
It'll be on our website. Don't worry.
Okay.
Well, great. So just call the clinic and then...
You can ask for the obesity clinic or the obesity metabolism clinic. If people desire to have consultation or attend one of the informational sessions regarding bariatric surgery, just ask for the Bariatric Surgery Clinic.
Great. Dr. John Purnell, thank you so much for being with us.
Sure, my pleasure.
And coming up next on the OHSU Effect, we're going to talk about sports injuries and how you can protect yourself. That's coming up next on KXL.